Smile evening, friends. Today is the third day of this seed therapy, the Monday series. Again, Sish started this series for us from the beginning itself. So all must give the 100% of your attendance here in the session. And you will get some time to get your doubts to be clarified at the end of the session. Okay? Now, with a very big smile, we can invite our Madam Huvinder Kaur to this platform. Smile evening, ma'am.
Smile evening.
Most welcome to this
Smile.
session, ma'am.
Smile evening.
We're very much gratitude to you for your presence. Thank you so much.
Okay, so we will start our session. I hope you have revised your previous lessons because if your foundation is strong, then you can understand next. Because not only theory part, we have to study practical part also. So today we will do some practical and I will share my screen. Today, actually, I want to discuss about spine diseases and how to do treatment with the help of seeds. So let us first see the vertebra location on main system and insect system, because we have studied two systems, and on the basis of these two systems, we will focus our seed therapy. So I'll share my screen. Just a moment, please. Okay, wait. Okay. So actually, it is very simple. You just need to focus once. These days, you will notice that a lot of cervical cases, lumbar cases, this is very, you see in routine. And treatment part is very easy. You can see just with one session of attending this class, you can start doing treatment. Okay. Now, first, you all know where is spine. This is spine. And we have cervical, 7 vertebrae, thoracic. You can see this is thoracic region, 12 vertebrae, lumbar, 5, and sacrum, 5. Then coccyx, this is contracted. This is fused, 4. So we have 33 vertebrae. Now, what we will focus today, cervical treatment, and you can see quick result. Cervical treatment, also lumbar treatment, then tailbone pain. These days, people are working on computer. They are spending a lot of time on computer. That is why this area, lumbar area, cervical area. So they experience pain here. Now, we have done a basic system framework and we have done insect system framework. And in this basic system, where is the point of cervical, lumbar, and coccyx? So this is the area of cervical, lumbar, and coccyx. But you should know the accurate point. Sometimes when you see medical report, you can see like this. There is a gap between C3 and C4, L3, L5, some disc bulge. So it is very important to know the exact location of each vertebra. So we can focus the location of vertebra, and then we can do practical part also. Now, you all know that hand is representing full body. Yes. And this is back view. We have discussed yin and yang concept. Front is yin and back is yang. So, spine part, we have to see on the yang hand. Head, this thumb is representing the head. Middle 2 fingers, legs, and side 2 finger, arms. And this is the central line, which is focusing vertebra section. So how to see or how to focus each vertebra? So it is very simple, not very difficult. So let's make these vertebrae so that when you do treatment, your seed, you have to fix seed on the correct point. Okay. So first of all, you have to focus central line. Now, where is central line? Below the thumb first. So, this, from this junction, this is the base of thumb. And here you will find on your thumb, below the thumb, you will find this protrusion. So, bone is ending here. Yes. And then one more line between two legs. Sorry. Okay. Now, on this line, we will study the location of vertebrae. Cervical 7 vertebra. So, 1 and 7. So, this becomes C1 and this becomes C7. Okay. And now, between C1, C7, we have to fill up C2, C3, C4, C5, C6, C7. 2, 3, 4, 5, 6, and this is 7. C1, C2, C3, C4, C5, C6, C7. So if you see a medical report, you can clearly find out this vertebra. Now thoracic has 12 vertebra, and because of this tilted thumb, thoracic, you see here, actually in our body, this is straight. Yes, thoracic 1 to thoracic 12. This is straight. Yes, but on hand, thumb is tilted down. That is why we will see two division of thoracic. Upper thoracic, this is upper thoracic, and this is lower thoracic. And on the level of T8, there is a bending. That is why until here, we will have T8. And just below C7, we will have T1. And between T1 and T8, we have to fill up 2, 3, 4, 5, 6, 7. So T1, T2, T3, T4, T5, T6, T7, T8. So we have from T1 to T8. Next is T9. This is T9. And now on this line, 3 division. Very simple way. One by one, you can reach each vertebra. Now, this level, we have to divide this line into 3 parts. This is from T9 here, T9 to T12. So, this becomes T12 and then T10, T11, T10, T11 and T12. Now lumbar. Lumbar has 5 vertebra, L1, this is L5, L2, 3, 4, 5. So L2, L3, L4, L5. And this is sacrum region, sacrum from S1 to S5. And last, this part, this is coccyx tailbone. So we should have general idea, the location of vertebra. Then only we can do our treatment correctly. Actually, if you can reach the correct vertebra, then just one seed is enough. Only thing is that if we don't know uh, exactly which vertebra is has a problem, then we have to add extra seeds. So now cervical, lumbar, and tailbone related pain. So in hand system, this area we will focus for neck pain, and lumbar area. This is lumbar region and this is tailbone region. Also, we should see in finger system. In finger system, very simple. On the first wrinkle, this area is cervical. Just one black pepper can heal this. After checking the painful point on all fingers, so just one black pepper can treat this point. And for lumbar, this area, you see, this is the last ending part of finger, and on this line, this much area is for lumbar. And last bone, yes, you see, this is when you bend your finger, bone is here. So this last bone, this is related to coccyx point. Now, for example, patient has cervical pain. Yes, cervical, this is back neck. Sometimes you know the vertebra, which vertebra is having problem, and sometimes you don't know, just general. Patient can say that I have pain here, then where to do treatment. Yes, so I will show on my hand also, but let us first make a framework where to do treatment. So in this hand, in basic system, because we have two system, basic system and insect system. So in basic system, this is the place where we will do treatment for cervical region, this place. Okay. And before doing treatment, we have to do ring massage. Warming up is very important. Sometimes just with the ring massage, patient can recover, but sometimes we need full attention, probe with probe, and also we need to do seed therapy. Sometimes just colors also can treat. So in basic system, this is the place. And here in insect system, this area, because this joint, this is one joint, but in this small point, C1 to C7. Only thing is we have to check all points. Which point is more painful? We will check all point one by one, and wherever patient gets sharp pain, strange and sharp pain, that point we will use for treatment. So this is insect system, cervical point. Okay, so we have the same pattern on the left hand. This is a right hand, and same we have on the left hand. So this area, here you can see patient has lumbar pain. Yes, lumbar pain, where you will do treatment. And this is very common situation, very common problem. Yes. And sometimes this patient can have muscular pain here, sometimes vertebra level pain here. Then where is the point? In hand system, in basic system, this area we have to focus, this one. This area we will focus. Yes, this patient is having lumbar pain. So this is the place. And in foot. In foot. Actually, in all chronic cases, if patient has very chronic lumbar pain, then definitely we should add foot treatment. As you know that Su means hand and Jok means foot. So if you do treatment on hand, it means you're doing Su treatment. And if you're doing on foot, it means you're doing Jok treatment. But if you're doing on both, then it becomes Sujok. Yes. Now, this is the place where we will treat for lumbar. And it is very important to do ring massage before you do seat therapy. And ring massage, this area actually you should do in all, this all part you should cover. But this area is very special zone. So whenever you do ring massage, you should focus that you pay more attention in this zone. Yes. So this is lumbar area. And now here in insect system, this is lumbar area. And if patient has coccyx pain, tailbone pain, yes, in tailbone pain, where is the place? Because when you see the body, you can transfer on the hand. Yes, last time we understood that hand is similar to human body. That is why it is very important to know your body. If you understand the location of organ in our body, shape of organ in our body, then exactly we can, focus on our hand. Sometimes we are focusing, in coming sessions, I will explain about seeds in detail. Sometimes we are focusing the shape of the seed. Sometimes we are focusing the character of the seed. Yes, and sometimes we are focusing the medical properties or medicinal properties of the seed. So this is the last part of spine. And how to see this point in basic system? Yes, in basic system, this is the last part. As you saw, all vertebra, this is the last part. And how to fix seed for treating coccyx pain, we will see in our practical. Okay, so now I want to show practical so that you can start doing in your home and you can see the result. So I will share my camera now. Just a moment, let me connect. Okay, so I need to share my different camera. Just a moment, please. Okay, wait. Okay, I think you can see. Can you see my hand?
Yes, ma'am.
Okay, good. So now let us focus first cervical pain. Yes, patient is having cervical pain. Then how to do treatment? Okay. So this place, you have to focus this place. Ring massage. Yes, actually you all have, I think so, because now these days people practicing acupressure, Sujok, they all have this ring. So first thing is that you have to do ring massage before you do seed therapy. So on thumb, ring massage is very important. It improves the blood circulation of this area. And when blood circulation is improved, then the point which is related to cervical becomes soft and very easy to find the painful point. Then on all the junctions, first below the nail, also you should focus this ring massage. As you saw in picture that below the nail, first joint is corresponding to cervical. Okay, so all first joint you have to focus. In case you don't have ring massage, then also we cannot stop our treatment. Sujok is that is why Sujok is beautiful, because even if we don't have many tools, we can just do treatment in a very simple way. So though ring is very important, but in case you don't have it, then with the thumb, you can do manual massage. So if patient has cervical pain, massage, this is called manual massage, rub the skin and until the skin becomes warm, and also do skin twist clockwise and anti-clockwise, but do it slowly. So skin twist, and you should pause and release. Then anti-clockwise, pause and release. Sometimes you will notice that in one direction, you are feeling more pain. For example, you are feeling more pain in this direction, then you do opposite side and then pause for few seconds. So you have to do this massage on the whichever direction you are experiencing the most comfortable direction. In that direction, you should twist and pause for few seconds and release. So several times you should do this. And you will observe, you can observe your neck. Yes, with this kind of twist, you can experience relaxation. And both thumb. Yes, and now second step by step. Second step, with the probe. If you're doing accurately, then definitely in one sitting, you can experience this cure, you can experience relief. So now this line, central line, as you have seen in the picture, this line, this you have to stimulate. It is very good that if you succeed in finding the painful point. Now, here, as you saw, seven vertebra. So, one by one, you can check all like this. Actually, when you press this point, definitely you will have pain. We all will have pain, but a patient who is having disease, that patient in his hand point is very sensitive and it gives very sharp intensive pain on pressing. So when you are pressing, please make sure that you don't press very deep, and also you don't press very softly, because we have to create circulation. And as soon as we find the painful point, very strange things happen actually. When you touch the most painful or sensitive point, then on pressing that point, electromagnetic waves are released, and these electromagnetic waves, these are curative waves, and it reaches our real organ or real body part which is suffering, and then these waves can cure that disease part. So for example, patient has pain here. Okay, this one point. So I'll mark with a pen this point. Yes, now see, this point is having pain. Now how to apply seeds? One is this point, of course, one seed on this point, and then one seed, like we say in our 5-step treatment. First is main point, and then we do surrounding point. So we have a technique. Yes, first is this point, and then up and down, 1 point here and 1 point down. And then on the same level, you see this is the point, and on the same level, left and right on the yin-yang line, this point. So I'll mark yin-yang lines. These are border, according to diamond energy system. These are border meridians, and in border meridians, very strong energy is flowing. And it is very good that you touch this border meridian. And then this point also. Now you can put extra seed also, doesn't matter, but make sure that you touch this side points. So this is these are the points, and then you can check all junctions wherever you get the painful point. For example, I'm having pain here. For example, this is the main point. You can mark this point, and then junctions and borders. So border means yin yang line. As you know that front is yin, back is yang, and this is yin yang line. And this yin yang line is very special line. Very strong energy is flowing between yin and yang, and this is very special actually. In your treatment, whether you do cervical or spine treatment, or you do in our coming session, you will study digestive organ and many other organs. So in all situations, if you use these border lines, yin yang line, this will add a very good power to your treatment. This point. Yes. So now we have to apply seeds. Now in this case, in insect system, we can apply this fenugreek seed. We can also apply star magnet, but now we are using fenugreek seed. Just a moment, please. I'll show you. So my battery is running. It's okay. Okay. So now we need paper tape. So first I'm showing on insect system. One center seed. The center one will touch the main point, and the side two seeds will touch the borders, and you can adjust. On the yang surface, fenugreek seeds are very effective because you see these seeds are flat. On yang side, we cannot apply this round seed because it will roll down. it will roll down. Yes, but fenugreek seed has flat surface. That is why these flat seeds can stay for a long time. So this is insect system. Also, if you are using insect system, first you try to focus on the index finger. Yes, and middle finger. In case you don't get painful point, then you come to little finger. Now, why I say that you have to use first insect system, because according to tri-origin, this is hetero finger, and middle finger, this is neutro finger. And hetero and neutro, these two forces, these are very active forces, and always like to change, accept change very quickly. That is why hetero finger and neutro finger is very good for using insect system. And if you don't get painful point, then you can come to this ring finger uh, and little finger. We have a concept actually. This is very detailed on the basis of tri-origin. Neutral finger is also very special. Sometimes when disease is genetic disease, or sometimes reproductive disease, this is like according to tri-origin, these are all neuto diseases. So for all neuto diseases, neuto finger, little finger is very good. But now we are focusing just simple cervical points. You can check actually. At present, for beginners, if you know these all junctions have cervical point, so you check one by one, and whichever point is painful, on that point you can do your seed therapy. So this is now insect system, and now in main system, now I will attach cervical point. You can add extra seed, as I told you, extra seed also. Now see how I will do. I am going to make 3 chains. Again, I am using fenugreek seeds. So 3 chain. 1 chain will touch the vertebra line, C1 to C7 line, and 2 chain will touch border lines. It will touch diamond energy system. This is center line, and then I am showing practical in detail so that you really experience result. And you see, you have fenugreek in your home. It is very easily available. You need paper tape. You should keep paper tape in your treatment kit. We have 2 sizes. These 2 sizes we are using. So you can arrange, yes, make 3 lines. Make 3 lines. Simple, very simple. So center line will touch the main vertebra line, and then, and if this is not coming on the, if it is not touching the correct line, you can adjust. You can always adjust. My main purpose is to touch the yin yang line like this. But don't forget to do massage before seed therapy. Massaging is very important. Before sowing seed in the soil, farmer is also doing this warming up. So this line, it is touching this yin yang line. Okay. So now you can check the chain, whether it is in straight line or not, like this. And if your this paper tape is loose, then these fenugreek seeds, it cannot create a pressure on the skin. we need little bit, we need to uh, uh, arrange seed or tie seed in such a manner so that it can create pressure also, not very loose and not very tight, like this. And then you have to tell your patient to press this line from time to time. Also, one more seed you can do, you can also use this green lentil seed. Green lentil seed. You can use these green lentil. And actually, if person is having uh, this problem since long, since many months, then I always like to, use variety of seeds. For example, today I did fenugreek seeds. Tomorrow I will do green lentil. I will apply green lentil. And also sometimes on the, uh, like this black pepper, this is big size actually. This black pepper is big size. I just wanted to show. But if you can find this small size, this is very effective on vertebra, especially when degeneration, because black pepper has hetero property and also it has medicinal property. Then this small size, I wanted to show all these sizes so that you can compare. If you use this kind of seed, this is big, this will roll down on the point. Yes, that is why you see this green lentil, the size of green lentil, and see the black pepper size. Both size very good, and this black pepper is smaller than green lentil. And I like this seed very much. And in all chronic cases, I always like to change the seeds. I did fenugreek today. Tomorrow I can do this black pepper, this same similar kind of chain, and maybe next day, then green lentil, and then come back again to fenugreek seeds. Because in chronic cases, sometimes you need to do 4 days, 5 days, and sometimes just one day is enough. First session and pain is gone. Many times you will see just first session is enough. But if you feel that patient needs more, then it is very good to change seeds, because each seed is having a different type of character. Yes, timing, you can keep these seeds for 6 to 8 hours. And if patient skin sometimes, some people, their skin is very sensitive. In that case, you can tell them to remove before also. Like some people in daytime, they are very busy, then they can do this treatment before sleeping, and whole night they can keep, and next day morning they can remove. And seed actually does not have any side effect. You can keep for more hours also. In some situations I have seen, I have advised patient to keep for 24 hours. And then in case patient needs second day the same treatment, then you can, for example, today you did on left hand, then next day you can do on right hand, because skin needs the rest. But you have to see the area. If that area is, if you see redness there, little bit of swelling is not not so much. But if seed is there for mm, 8 hours, 9 hours, so some redness you can see. If you see this kind of redness, then you don't apply seed there. Yes, but if skin is okay, then on the same point, actually after finding the painful point, then on that point at least you should do seed therapy for 3 days continuously. This is very effective, because finding painful point itself is a victory. It is a very big, it is very big achievement if we succeed in finding the real point. That is why we should not miss. And that uh, point has that point can create curative waves. Only the point which is sensitive and which is real disease point, has capacity to create the curative waves. Not all points will create curative waves. That is why you have seen that when you do seed therapy, many times you don't see result. Many times you do a lot of seeds. Yes, many systems you do it on insect mini system, partial system, but still we don't see result. Why? Because we have not touched the main point. In case we touch the main point, actual point, that point, on that point, one seed, just one seed can cure the disease. Just actually we need one seed. Just why we are doing multiple seeds? Because maybe we are not sure about that painful point, and we have to do practice on our hand before we do on patient hand. Yes, how this point is giving pain, and all people will respond different, in a different way. Old people, kids, yes, middle age people. So we have to understand this concept, how much pressure I should give. Yes, and then we have to also we have to educate, we have to tell our patient that I'm giving this therapy, and in this therapy, this is our pattern, finding the painful point. And if I'm pressing, definitely you will get some pain, because patient sometimes is jumping even with the natural pain. But from the very beginning, if patient knows that the difference between routine pain and the strange pain, then this patient will guide you properly. In that case, one point treatment is enough. Okay. Now, this is your cervical. This was your, we did cervical case. So now this was hand, but in foot also. We should know in foot also, because chronic cases, maybe you need foot treatment. Same type of seed therapy you can do on foot. Now, in basic system, according to basic system, foot system, where is the cervical area? Same pattern. Same pattern. In hand, this is cervical area, and in foot, this is cervical area. And in sex system, same like fingers, first joint. This is cervical area, and in foot also, first joint, just below the nail. This is cervical area. So it is very good that we check. See, I'm talking about very serious, severe cases. Actually, normal pain, just one sitting is enough. One sitting, two sitting, four sitting, maximum 1 week. In that also, sometimes why we need 1 week, because maybe we have missed the real point. But in severe cases, degeneration, and severe cases, some disc bulge, or in that cases, we need proper attention. It can take a little bit more time, but if you do it good treatment, you will see the result in difficult cases also. In foot also, this area after doing massage, and then when you fix it, please remember the same pattern on the yin yang line. Yes, don't forget. Of course, one line is here, and then one line this area, and then this area, just like the thumb. And in toes, very, very effective. So but this area is very sensitive, very sensitive. So you cannot press deeply like you did it on hand. So you see, when you press, you have to, first you try on your foot, then only you will know that how much pressure is required before you do on patient feet. Yes. So you check one by one, and in this area, small, very small black pepper, very small. And if you don't have this small size, then fenugreek seed or green lentil. But in green lentil also, we are focusing small one. We are selecting smallest one. It is also having, it is showing many sizes, but this is like green lentil. smaller size. So one seat here or wherever patient is getting pain on that toe, you can fix this seat. Okay, so this is cervical pain. Yes, so cervical pain, whenever you see this patient, don't hesitate. Definitely you will see the result. First, do ring massage. If you don't have ring, then do manual massage. You do twist therapy of your this thumb, and then and in very chronic cases also, I wanted to say, in degenerative cases, before doing seat therapy, you can do moxa also. It is also very effective. Okay, and then seat therapy. Now next we will focus lumbar. Hmm? Lumbar. Lumbar is lumbar area, this hand. Now, any disease, like I can see in chat box name of diseases, the beauty of correspondence system is don't focus the name of disease. This is simplicity. Very simple. Don't focus name of the disease. Just focus where is the disease. Very simple. Where is the disease? If you start thinking, oh, this name, that name, and medical terms, oh, then it is very difficult. Yes, for non-medical people, they are thinking this, maybe this is very difficult disease and I cannot treat. Don't think like this. You can treat all kinds of diseases, all kinds of diseases. So whenever you see medical report, don't worry. Just see where is the disease. Oh, this is cervical disease. Then in Sujok systems, where is cervical area? In main system, where is cervical area? In sex system, where is cervical area? And if you know more, then in mini system, where is cervical area? In hand and foot. That's it. Don't worry about disease. Just think where is the disease and start your treatment. Definitely you will see. Only thing is, if disease is little serious, chronic, then you have to do more sittings. Yes, of course, when we have knowledge of higher levels of Sujok, Triargen and 6 key, then maybe we can add more steps. Yes, more steps to that treatment for these kind of chronic cases. But definitely you will see result. Definitely. Some percentage, I'm talking about serious cases. Yes. So now lumbar area. In hand, this is the place where you have to focus. So this is central area. Even if you don't remember that one by one, L1, where is L1, L2, L3, L5. But simple thing is, this is your backside of palm, exact center area. See, exact center area. This one, this one. So if person has any pain here, so you have to massage here between two bone. There is a, you can see the hollow area, hollow depression. Yes, you can see this. So between two bones, you have to massage. You can do manual massage here. We don't need to do, we don't need pointed probe. So we can do manual massage in this area. Just with the massage, if disease is not very serious, just with the massage, you will feel the relief. Lumbar pain, okay? And in sex system, this area, you have to focus as we saw in the picture. How to fix seeds. So in this area, in main system, we can add green peas, dry peas. We can add black pepper, but big size black pepper, big size. Both are very effective and not very small, because here because of this hollow area, hollow between two bones, we need little dense seed, little heavy seed, dense seed, so that we can stimulate that point which is hidden deep. So we can use and show. You can use these seeds. Also, you can use black pepper, but big size. But big size. So this is good seed. You can use peas, dry peas, dry peas. So with the help of paper tape, so I'll remove this. So you have to prepare your treatment kit so that, when patient comes immediately, you can start your treatment and you don't need to go to your kitchen again and again. Okay. So in a line, actually, you see, these seeds are not green pea seed. You can use green pea seed, but this is white beans and white beans, white with dot. You can see the dot here. Beans. But this seed has edge, pointed edge, and this pointed edge can go deep inside that hollow part. Arrange in one line. You can put extra seed also, doesn't matter. And check the chain. And if you need support of paper tape, if you need more, you can add. So applying seed, this is like artistic work. Not necessary that you add or you stick like this. Some people, they do like this also, add like this also. Yes, to support. There are many techniques. So this is an artistic work. Only thing is that you should fix seed on the correct point. Now, you know that you have to press this area from time to time. Yes, that technique, press. And 6 hours, 8 hours, 10 hours, you can keep seed therapy. Actually, you can minimum 6 hours, maximum, no problem. You can keep for 24 hours also. 24 hours also. But next day, when you're doing this treatment, better you use new seeds. So this is for main system. And for insect system, lumbar area, again, I like this small black pepper, small size. Lumbar pain, after doing main system, better you do both system as a beginner, because uh, if you know how to do correct point, then one point, as I told you, is enough. But we'll do at least two systems, insect system and main system. Small size black pepper. After finding the point, this is lumbar area. In all fingers. First choice is this. Yes, sometimes with massage, pain goes. So you have to massage this area before you do seeds. And then before this, first ring and then probe also, one by one. Yes, in case you find the painful point, then on that point you will do extra massage and make sure that your seed is touching that point. And in case you don't find point, you can arrange like this. But here again, please add one more chain on the borders. You can sometimes, use this technique also, center black pepper and on the borders, green lentil. But when you do green lentil, make sure that white dot of this seed stays on the top because it will touch the skin. So this green lentil will touch the yin-yang line, as I told you, borders, surrounding point, or we can say borders. Very effective treatment. But now your tape should not be very loose. You should feel pressure on the skin and press from time to time. One more seed additionally you can do, though I have not touched mini system, but you can just note down the point. One point is very important. On little finger, this was insect system, but on little finger, just below the nail, this line, three or four fenugreek seed in a chain, you can fix for lumbar pain. So one was basic system, insect system, and this point is related to mini system. So wait. Idea is that patient should get relief. That is why I want to show these steps clearly so that really you can use on your patient and can see smile on their face. You see, 3 seeds enough. Below the nail, and after doing this treatment, like you did main system, you did insect system, and you did mini system. And after doing this treatment, if you feel that 50% pain is gone and 50% is left, then please do it again next day. And don't hesitate, even if you need to do for 1 week also. Don't hesitate, because this seed therapy, if it can give even 1% relief, it means it will give 100% also, step by step. Keep patience and do it regularly until and unless you reach the perfection. And don't forget that we have to focus in case if disease is little difficult and you are not seeing good, I will not say good, but not full percentage result, then please add foot also. Foot also. So where is lumbar point in foot? Middle toe, to middle toe, central line. Yes. Now this is lumbar area. Massage this line, and again black pepper, small size black pepper you can fix, or star magnet also. So in place of seed you can do star magnet. Seeds are available. You don't need to run also, but if you want to use star magnet, this is also good. People, those who are practicing acupuncture, they can do acupuncture also. So this is the place where you have to do seed therapy. And in insect system, in toes, this place. Yes, after doing good massage here. One more point, it is very effective for all back pain and leg pain. I should tell you, all kinds of back pain and leg pain. This point is very effective. This point, you see the nail, and near the nail, three fenugreek seed in a line in horizontal pattern. I'll show. Three fenugreek. Yes, this way. People who are experiencing leg pain and also lumbar pain, and you actually, you know that UB meridian ending point is here. This is very good for all kinds of back pain and leg pain. Just below the knee. Yes, you can do this. And for sciatica pain also, this point is very good. And with actually for sciatica pain, we have to treat lumbar area, lumbar area. So there is a question, is it good for buttock pain? Yes, you can use for buttock pain also, but for buttock pain additionally, I saw a message in the chat box. So for buttock pain additionally, you should focus this massage. You see this area, this area, massaging is very important. This part, this part. Yes, for knee pain also. Next time I will discuss this knee pain, but now I'm focusing one by one actually. Yes, if I mix up many cases, then we will lose the information about this pain, because I want that you really get good result in treating cervical pain, lumbar pain, coccyx pain. Now I want to show how to treat this tailbone. You will see very quick result in coccyx pain also. So where is the point in basic system? You see this area. I'll mark this area. So spine is like a hook. You see lower part. This is like a hook like this. So now when you fix seats, you have to make U-turn to create this hook tailbone. Okay, now see. Here also I need little dense seed so that it can, go deep inside and can create acupressure type of pain. Black pepper in many diseases you can use actually. I like it very much, not because of shape or color, but it has medicinal property. And also you have to check before doing this seed, also check, press and check. This is not, it should not be broken, because some black pepper when you press, you see, you press this, many, now this is okay. You have to be, this kind of accuracy you should have, not just randomly putting seeds. So checking also is important. This is okay. Some black pepper easily can be crushed, like this one. See, crushed, see, crushed. So now I'm doing for coccyx pain line, at least five, 6 seeds to make that hook. So my chain is ready. Then see how I did it once again, this line, and I want to create this kind of shape. So front and back. And then support with the paper tape so that it doesn't come out like this. Like this. Very good for coccyx pain, and check that this seed is creating pressure. It should not be very loose. If it is loose, then it is not good, but not tied to that extent uh, that it creates discomfort. Okay, so like this. And in for coccyx pain, again 1 point. I'll remove. Now I'm talking about coccyx pain. Again, the same point, but here previously we did three fenugreek seeds for lumbar pain, but now one seed is enough. One seed. Check all points one by one. All points one by one, and wherever you get pain, wherever you're getting sharp pain, this is just below the nail. Just below the nail. One seed is enough, actually. Tailbone pain. Yes, you can take. Okay. So I hope that you have understood this, and now you can ask question related to this kind of disease. Is it clear? I hope. Can you write in the chat box? Do you feel confident with cervical treatment? Cervical, lumbar, tailbone pain. Very good. Good. Okay. Now, do you have very good? That is why I want to go very systematically and not rush to not rushing to so many diseases. Final purpose is that you can do treatment and you can see result, you can cure many patients, and you can receive many blessings. Okay. So now you can ask questions.
Those who have doubts, please switch on your video and raise your hands so that we can unmute you one by one, please. Thank you.
I don't have your
Good,
voice.
good evening, ma'am.
Good evening.
Smile, ma'am. Ma'am, already I have operated the lumbar area, ma'am, because I had pain that is past 20 years, ma'am. After that, what can I do, ma'am? Lumbar pain?
Yes, you did main system, this system.
Okay, ma'am. I had operated, ma'am.
Okay,
That,
don't worry. You do it on your
okay.
hand the same way because
Okay,
we are
ma'am.
not touching your main lumbar area.
Hmm.
Yes. So you just saw how we did lumbar
Hmm.
points. Please start
Yes,
doing it.
ma'am.
Yes,
Okay.
start doing it. Definitely it will heal very quickly. No voice.
Ma'am, because
Yes.
thighs are becoming very tightened also, ma'am, because
Yes.
of the
Along with
operation.
yes, yes, yes.
Uh,
Don't worry. First you do
uh,
actually if patient has undergone operation, then moxa is very good. Moxa, because according to energies, operations and all these surgeries and accidents, this create coldness energy in body. So you do moxa before doing your lumbar points and ring massage. You will see relief.
Next is
You will see.
hello, ma'am.
Yes, please.
Ma'am, I just wanted to know the area for buttock because pain of the cervical, of the lumbar, which is going to the buttock. So in center of the buttock, it gets stuck. The pain doesn't move from there.
Buttock, but left buttock or right buttock or center of buttock?
Center of buttock, more towards right buttock.
Okay. So one is this, like you saw coccyx pain. Only
Yes.
thing is that you have to add more seats and you bring your chin until here.
Okay. Between the two bones, a little more down.
Yes, little bit more. And then press this point. Along with that, this point, and this
Okay.
point. You can see between index finger and middle finger, this area, the hollow part, this you have to press. Along with that, you can fix two green, dry piece also.
Okay.
Dry piece also.
Okay. And ma'am, at the leg, at the feet also the same way.
Yes, yes. Feet also the same way. You see, you know that this is the sacrum actually.
Yes.
This line is between buttocks, sacrum,
Correct.
and additionally, you see this part, one
Yes.
point here, and between this index toe and middle toe here.
Okay. Same between the knuckles, we can
Yes.
do. Okay. Thank you so much.
Balaji ma'am, please switch on your video. Balaji Rajeshwari ma'am. Yeah.
If it is related to this spine, lumbar, cervical coccyx, then it is good because many things I will be telling in coming series because we have so many diseases and we cannot cover in one day. Yes, please, Balaji.
Madam, good evening, madam.
Good
The
evening.
same treatment is applicable for the disc bulges on all the lumbar levels, madam.
Yes, you please do it. Yes, yes. Please
Then?
do. Yes, yes. Yes, yes.
That another one, a small doubt, madam. Last step you told that additional seeds should be applied to the little finger below. Isn't
Yes,
it, madam?
below the nail. Correct.
Only the little finger, madam, or other fingers also?
You can check actually if you find painful point in ring finger, you can do there also. You can check.
Okay, madam. See, the lumbar canal stenosis, madam. I'm suffering for the past 10 to 20 years.
Oh
Every
my
time,
God.
yes, madam. Yes, madam. I am applying peace only in the hand only, but
No,
not,
finger.
yes.
Add finger. Yes, yes. Add
Yes,
finger.
only finger only, not applied in the legs. See, somewhat I am managing. Every 3 months I am taking current and that laser treatment and all that. So very difficult to
Add
manage.
this also. I told you 3 points
Yes,
here.
madam. Now I will try, madam, and tell you
Please
the
see
rest.
last session video also. There I introduced insect system. Why these points are important.
Yes, madam. Last week also I have attended. I have asked your doubt. After that, I am following your advice, madam. So I will try. Thank you, madam. So kind of.
Yes, please. Meenu Agarwal.
Smile evening, ma'am.
Smile evening.
My question is different, ma'am, not spine. If you say yes, then
You can ask if it is like I have to show if it is new type of question, then I will tell in next session. But if it is yes, what is your question?
Ma'am, two question actually. If breast milk is not come properly, what treatment I do?
Okay, I can tell. I can give answer now. Wait, I'll tell you. Let me draw for you.
Okay.
Can you see my hand? Breast
Yes.
point.
Yes, ma'am.
This is
Yes.
first is that this point. Yes, first is that you have to focus this point. And now, if milk is not coming on this point, also I should show on insect system. Did you understand?
Yes, ma'am.
Now, how to do treatment? On the point, you do clockwise massage on both breast point. First, press little deeper because here we have fleshy area. Press little deeper and do clockwise massage. Nice clockwise massage. Yes, for 1 minute each breast point. Yes, clockwise massage, clockwise massage. And then after that, soya bean seed. Soya bean seed produces milk. You know that. Yes, because of milk character. Then after doing clockwise massage, then you fix soybean seed on the breast point and then press also. And sometimes, you know, on insect system, fennel seed, like on one finger, you can add fennel seed and soya bean. This combination is very good. You know fennel seed?
Okay, fennel seed.
It is very good. And do it for twice a day. Twice a day. Maybe second day or third day you will see. And you take care of your nutrition of nutrition.
Ma'am, which food and vegetable seed?
Eat good food, protein food, good food. Yes.
Okay, ma'am. Ma'am, I apply red color, her hand.
A red color is also good. Red color is good. You can add this color also. Very good.
Okay, ma'am. My second question is, ma'am, if penis is bent from the middle portion in the inner side, I should treatment this?
Then I can discuss in our coming classes.
Okay, ma'am. Okay, thank you so much, ma'am. So,
yes, please, next.
Good evening, ma'am.
Good evening.
Ma'am, I want to ask you, if a person's body is tilting on the left side with little pain, buttock pain also, then where
Yes.
do we put the seat?
Please start working on spine, moxa, and it is not just lumbar. In this case, we have to pay attention to this complete section, spinal section. And then better you on mini system, I have not touched, but central line, you know that according to insect systems, line is complete spine system. So massage, moxa, and then make a chain of fenugreek seed. Yes, give attention to this complete area. And orange
How many
color.
days? Orange color.
It depends that how you do it systematically. Yes, and then orange color on this index finger central line.
Okay.
This you
so
have to.
Probably how many days it would take? Maybe a month?
You have to, yes, you do for a month, and definitely you will see some change. And if patient needs more, you can add more also. But yes, in 1 month you will see change. Orange line also on index finger. In daytime you do this color therapy for 2 to 3 hours. You can keep this color.
Only the index finger?
And only index finger, because it is related to hotness energy. This person needs hotness energy. Vertical axis is, you said that it is tilting like this. So we need to improve hotness energy or From axis point of view, we say we need to improve vertical axis.
This is for advanced stage of tilting also.
Don't think so much, just do treatment now.
Okay, thank you, madam. Thank you
Just
so
do.
much.
And do it regularly, nicely.
Hello, ma'am. Thank you for
Hello.
the prediction, ma'am.
Yes.
Namaste, ma'am. Okay, ma'am, I am a C-section mother, so I am getting back pain exactly opposite to my breast. What is the
Back
color?
side.
Exactly
Yes,
back
orange
pain.
line. Orange line is very good for spinal disease because hotness related
Orange,
to
where, ma'am? Where to put?
in central line in index finger,
Orange.
exact center line. But for this pain, because you said it is behind your chest, exactly
Yes, ma'am.
behind your chest. So I'll just mark, and then on that chain, on that line, you just apply. See, just like lumbar. Can you see this?
Okay, ma'am.
This
Okay.
one, this
Okay,
line.
ma'am.
This
Yes,
is
ma'am.
for lumbar. This is lumbar.
Okay.
And exact center, this line, on all fingers, you can
Okay, ma'am.
pay attention to this line, ring massage, and you we did the seat therapy on the lumbar. Same pattern you will do here.
Okay, ma'am.
Okay.
For all fingers, ma'am?
No. You check. If you can check, it is very
Okay.
good.
What
It
does?
improves.
Okay, ma'am. I'll do it. Thank you for the beautiful section, ma'am. I'm so happy with your explanation. You explained very well with the neat and way to stop, how to tell. This is so beautiful, ma'am. Thank you for the
My
opportunity to give me.
aim is
to
that
talk.
you feel, you see the result, you experience the result. When you are getting
I'm
result,
feeling
then it is good
positive.
achievement.
Now only I'm feeling positive. Thank you, ma'am.
Yes.
Please unmute yourself, ma'am.
हॅलो आवाज आला हॅलो
Yes,
Hello.
ma'am.
Yes, I can hear.
हाँ थैंक यू तुम्ही आपने बहुत अच्छी तरह से पढ़ाया मुझे बहुत बचपन से स्पाइन को प्रॉब्लम है मैं ये सब करूंगी खाली एक पूछना था जो रिस्ट पेन है वो स्पाइन से रिलेटेड आहे का रिस्ट पेन इज रिलेटेड इन स्पाइन
Wrist pain, for wrist pain, I will suggest two areas. One is cervical area and second is which wrist? Left or right?
left
Left wrist. So in left hand, I'll mark. 1 day treatment it will go. You see, if you do it correctly. This is left wrist area. So this joint, on this joint, you have to do a good ring massage twice, thrice time a day. And also you have to pay attention to cervical area. So two areas you have to focus. One is this and one is this area. Yes. And then on this, you can do seat therapy. You can cover this complete joint with the paper tape.
I will
Cover this complete joint and keep this seat chain for 7 to 8 hours. And then give rest. Next day, do it again.
ओके वंस अगेन बहुत बहुत धन्यवाद आपको बहुत ईश्वर की दुआ मिले सबको बहुत अच्छी तरह से पढ़ाया आपने
थैंक यू Yes, Sandeep ji, you want to ask?
Yeah. First of all, thank you very much for such a nice session. And actually, I want to confirm about the vertigo, ma'am. Those who are having the cervical spondylosis, when they are having the vertigo, then what should they do?
Yes. First thing is, as you have seen cervical area, first thing is you will do cervical treatment. Are you confident with cervical treatment?
Yeah.
Okay. Then you should pay attention to brain point.
Okay.
Brain point. And one more point, it is very good to treat liver along with this. because
Okay.
as per our higher level, liver is
Mhm.
related to wind energy. So in
Right.
vertigo, it is good to harmonize the energy of liver. So three areas you have to focus. One is cervical. Then
Mhm.
check all the brain points. You know, this is face.
Yeah.
Yes, you know, this is face, neck,
Yeah.
and
Yes.
top
Yes.
area, this is all brain point.
Brain. Yeah.
Yes. And then liver point. Liver point I'll mark. And then sometimes when we discuss liver disease in future, you can focus more.
Sure.
So in mini system only, I will tell you. For example,
Mhm.
this is in mini system. We have not
Yeah.
done this. Yeah, this is liver point.
Right.
So in this area, you can, after doing good massage, you can fix green lentil seed.
Green. Yeah. I knew that.
Lentils. So this liver
Yes.
point, not only little fingers, the same direction, all finger will have this kind
All
of.
fingers and all fingers. Right.
Yes.
Right.
So you can check or you can keep changing the finger also.
Right. Ma'am.
Hmm.
One more question from
And
where
foot
we can get.
also, pay attention to brain point, cervical point, and if possible, liver point.
Brain answer. Yes, ma'am. And from where we are getting the recordings, ma'am, of your previous sections?
It is there in Kerala group.
Oh, I didn't find it. Okay, I will take it. Thank you. Thank you very much, ma'am. That's it.
Yes.
Hello. Good evening,
Hello.
ma'am. Smiley.
Good
Good
evening.
evening.
Good evening.
Yeah, very wonderful session, ma'am. Ma'am, I have this left elbow pain, ma'am. Sometime I'll get the cervical in the left side pain also, but mostly this left elbow pain, it is happening very frequently. So,
Okay. So, first is cervical. You are confident with cervical treatment? Okay, you
yes,
have to
ma'am.
do, yes, you have to do in two places. One is cervical area,
Cervical
and
area.
you said left elbow, yes?
Yes, ma'am.
Left elbow. So in left elbow, index finger middle joint.
Middle joint. I have
Yes.
pain also in that joint, ma'am. When I press, I'm
Uh,
feeling pain.
Okay. So left hand, index finger middle joint, and in right hand, little finger middle joint. Please don't forget, this is related to left elbow. Once again, left hand, index finger, middle joint.
Middle joint.
And in right hand,
right hand,
little finger, middle joint.
Middle joint.
This is related to left elbow pain, and you have to do ring massage 3 to 4 times, yes, in one day. And after ring massage again, tie this area with fenugreek seed. You can cover, and if you have moxa, before doing seed therapy, if you can do moxa, then it is very good. After
Yes,
this, then you can, yes, like a ring, you can cover this area with seed, fenugreek seed, and keep it for 8 hours, 7-8 hours like this.
Okay. Night I will do it, ma'am. Thank you. And I will update you, ma'am. Thanks for the time. Namaskar.
Yes, like there is a message I saw in chat box for epilepsy. Yes, brain you can use. Brain, definitely brain. All brain points, in fact, index finger, all top brain points. Thumb brain point, multiple brain points you should massage and check if you can succeed in finding the painful point, then you can fix seed on that point. Yes, Meeraji?
Hello, ma'am. I've got one question. I have got numbness in the soles of my feet, especially the front half. Yes.
Okay. So, Now, lumbar area you have to do focus lumbar treatment. You remember basic system lumbar area,
Yes.
insect system lumbar area, mini system. So lumbar treatment we have done just now. So you will focus that. Along with that, you said left foot.
Both the feet.
Both.
Both the
Okay.
feet.
Okay. Then middle two fingers, this area. This area, you can see.
Yes.
Yes. In both hand, lower phalange, last phalange, you have to massage nicely and do moxa on this area. And also you can apply orange color. When you're orange color, you apply only on one hand. For example, today you did orange color on this hand. Tomorrow you can do here like this. So good ring massage in this area. Color therapy orange.
Okay.
And I told you lumbar point along with this.
Orange color for the side or the full.
You can just exact center. I'll show. Like this.
Okay.
Yes. And then you need to find, do you have diabetes?
Yes, I have, but it is 6.5 HbA1c. And morning it was a little high, it was 133. Recently I got checked. And afternoon post lunch it was 140.
Okay. Then in coming sessions, future sessions, when we focus diabetes point, you can add that point also.
Okay. Thank you, ma'am, very much.
Brain point also additionally. Brain point. Okay. Yes.
I'm unable to hear you.
Yes, please.
हाँ बिल्कुल शोल्डर पेन आपका ये सेशन बहुत अच्छा लगा वेरी नाइसली यू आर एक्सप्लेनिंग शोल्डर पेन काफी टाइम से है दिस लॉन्गर साइड दैट बिगर हाँ राइट वन और
Right
पीछे
shoulder pain.
पेटुला बिगर बोन नॉट दैट आल्सो
Scapula also.
right
Okay.
so I'm doing on this actually right finger this portion I'm doing and mini system I'm doing here also.
This is actually this,
Yes.
you have to focus here.
Massage. Yes. Okay.
Yes, this joint,
okay.
not
Yes.
here. This joint
Down,
and also massage this bony part, deep.
Okay.
It needs deep massage.
Okay.
And then go back also this area.
Okay.
Okay, now one more point is that in this area, you see, this area you
Center.
have to massage.
L4.
Yes,
Okay.
this area nicely massage.
Okay.
Deep massage, and then you have to fix seats. In this area, you can fix dry piece, green piece. You can fix here.
Here, no seat. Here, I can put any
Yes,
seat.
of course. Yes, of course. Seats. Yes.
Seats. Okay. Thank you. God bless you. Thank you.
Yes, please.
हेलो हाँ जी गुड इवनिंग मैम
गुड इवनिंग
मैम मेरा ना छोटा बेबी है 1.5 मंथ का तो मैम उसको फीड कराती हूँ मैं तो कैसे हम इंक्रीज कर सकते हैं ब्रेस्ट मिल्क
Yes, I have just explained this. You can see in recording. I just touched this point.
Okay.
I've explained this case already few minutes before. How to increase breast milk. Yes, next please.
Kumaran sir, please unmute. Sir, unable to hear you.
No voice. I cannot hear your...
Kumaran sir, unable to hear you. You're not audible. Your voice is not joined with the session. So I request you to please ask in the group. He's unable to find his audio. Vidha ma'am, please unmute.
Good evening, ma'am.
Good evening.
Ma'am, I want to know about ankylosing spondylitis treatment.
You can now, as of now, you can start treating spine, and then when we go a little deeper, then we can add more points related to energy field. But as of now, you can just start treating this spine points, and then orange line on spinal cord meridian, and that is in index finger middle line. Every day, orange line.
Okay, ma'am.
And do this color therapy in daytime.
Daytime. And ma'am, she's having a woman having this problem, a patient, and his neck is do like this.
Neck is tilted?
Bend, yes, bend in front.
Bend in front, yes. Again, yes, you have to focus cervical points and orange line. This is, we have to strengthen
Both
the
hands,
spine. We have to tonify. Yes, both hands. Index finger, middle line. Now you do just this. And then later, next time, maybe in future when we are studying energy concept, then we can add.
And too much
Because
fatigue
now I am
also.
giving answer as per the consciousness of, beginners.
Okay.
And from level 1 or level 2 point of view. But we have triurgent concept, we have diamond concept, we have many other concepts. But if I tell you, you will not understand. So we have to actually attend this all Monday sessions to absorb completely.
Yes, ma'am. And too much fatigue also, ma'am.
Fatigue, you have to maybe next time, maybe I can touch this energy point. For fatigue's energy point is the most beautiful or very important, I can say. But in present moment, I cannot tell because it is big subject.
Fatigue is not a cause of this?
Fatigue, yes, there are many reasons, but energy points can cover many things. We have energy points can open your, that blockages inside. And also it has relation with many organs actually.
Okay, ma'am.
Yes.
Thank you. Thank you so much, ma'am.
Ruchi ji, yes, Ruchi ji.
Good evening, ma'am.
Good evening.
Ma'am, I'm having pain in right hand, middle finger, second joint. Right hand, middle finger, second joint. The knuckle side, I'm having slight pain the past 1 week.
1 week. Any medical report? Some
cholesterol is there, ma'am. Baki legs वगैरह में
what
तो
is there? Cholesterol is there?
Cholesterol.
Uric acid?
No, ma'am.
Arthritis? No, nothing. So first thing is start doing ring massage.
Yes, ma'am.
Very effective. Yes. Second thing, because you are having in right hand.
Yes, ma'am.
Then according to Sujok, this is the right hand. This area is right hand.
Yes, ma'am.
And the tip of this index finger from front and back, just below the nail, you should fix fenugreek seeds here, just below the nail. It will touch actually all fingers of right hand. Yes, and then tip. This is the place for fingers of right hand. Yes, next.
Ma'am, the leg, this stands for leg also, no? The middle finger.
No, no. According to Sujok, this is leg. Yes, but you are having problem in right hand, not in your real leg.
Yes, ma'am.
Yes. So
Yes, ma'am.
in Sujok, this is leg, but here we are not focusing leg. Where is the disease? If your disease is in the leg, then we are treating, then only we are treating this. But you never told me about legs.
No.
Please try to catch like this. If you have leg disease, then only we will touch these two fingers. Otherwise, we are not treating this. Now you have disease, you have problem in right hand. Then Sujok is representing full body, head, neck, chest, abdomen, two leg, head, two finger, arm.
Yes,
then where is right hand? We are looking like this. Where is right hand in Sujok body? So right hand is here. This is right hand. Yes. This is right arm. Okay. Yes. Swati ji.
Yes. Hello. Ma'am, when you have pain in the right side, you use the right hand, and when you have pain in the left side, you use the
First
left.
choice. Yes, this is first choice.
Okay, so you don't apply it in both the hands.
Actually, like whole concept is based on finding the painful point. For example, if person has right knee pain, our first choice is primary. Primary means this is when right problem we are treating in right hand. So this is our first choice, right knee point. Okay. In case we don't get painful point, yes, or you don't get result, then you can come to secondary. Then in this left hand, this is right leg and middle joint is right knee. But
so back the
right,
pain is the right, and the pain is more on the left hand. So you will treat the left hand, although the pain is on the right feet or
no,
something.
no, no. If you have right feet, if you said right foot problem,
yes,
right foot problem, then first come to right hand.
Okay.
This is right hand, and in right hand now where is right leg? This is Sujok body. Now you're looking Sujok body on right hand. And now where is right foot?
There.
Where is right foot?
Right.
So this is right foot.
Okay.
Correct? This is right. Don't see like this. We have to see like this. See? Front is yin. We can bend. So in Sujok body, which area we can bend? This area. So it is matching now. You see like this. We are not keeping like this. Then only your right and left concept is coming, it is clear. If you keep like this, then left and right is going opposite direction.
Okay.
So front body, if you're focusing front body, then see, this is my front body now. See, I can bend and this body can also bend. We both can bend, but back we cannot bend. This back also we cannot bend. So my front and Sujok body front is in same direction. My front is looking this laptop screen, and my Sujok body front is also looking the laptop screen. So always keep your hand direction like this. Then only your left and right is coming clear.
Okay. Got it.
Yes, please.
Hi, ma'am. Thank you for a lovely session. I'm new to this thing. I have a question. I have had a problem with my back, the middle back on the right hand side of the spine, and it has been for 1.5 years or more. And then I went to the chiropractor. They said that I have got inflammation and also that there is some space between the disc. So then they did massage and straightened the spine, and I did treatment for I've been doing for 1.5 years. It has been better, but it's not completely gone. So what can I do to help myself?
So first, you have understood lumbar points?
Yes.
Yes. So you have to do that. And you know, this is the lumbar area. In insect system, this area, because of inflammation, you can apply blue color on this, in this area. Dark blue, ink blue color, dark blue color.
Okay.
And also one finger you can apply blue color, and second finger you can do seed therapy.
Okay.
Therapy.
Okay.
So do it religiously every day. This is called main system's lumbar point. This is called insect system, finger system lumbar point. On one hand, you do dark blue color, and on this finger, you do seed therapy, and do it every day. Massage, also don't forget to do ring massage, and you will see good result. In 1 week, you will see the change. If you're doing really systematically, as I have discussed today in our class. That is why I'm showing step by step and slowly, so that you catch and you really do it.
That's right. It was really very good. We could learn everything properly. So thank you very much for the session. Thank you, ma'am. Thank you.
Yes.
हेलो, हाँ सॉरी आई एम फॉरगॉटिंग दैट. मेरे ये बीच के दोनों उंगली है ना, दोनों हाथ की, वो बहुत पेन करती है. आई हैव अ सर्वाइकल पेन और नी पेन ऑल्सो.
Okay. Cervical, you know. Maybe next time joint concept I will touch. Maybe it in Monday series we will touch many diseases. So cervical you can start doing. And second, you said knee pain. I will tell now.
नहीं. फर्स्ट ये दोनों हाथ नी के है, इसी हिसाब से दोनों दुख रहे हैं क्या, पेन हो रहे हैं?
No, not like this. It is not like this.
Okay.
First, we try to locate pain on our main body, real body. It is main body. And then we transfer on Sujok body. So don't see here. Now, if you have pain in middle two fingers, this is not a knee problem. This is your, according to your body system, these are your middle two fingers as part of hand. Now, please, before speaking Sujok language, you should say like this: I have middle two fingers pain.
Middle two finger pain.
These are not, see, these are middle two finger. Where is the pain? You are having middle two fingers. And then you transfer, where is this point in Sujok? Like this, we have to think. We have to, you know, organize like this. Sujok consciousness is like this. First, these are middle two fingers. And then where is the point of these two middle fingers? So this is left hand first. This is left hand. Okay. Now see like this. Middle two fingers. Now we are thinking, we are coming to Sujok body. We have to be very clear that where we are. So now Sujok body, because I want to find the location of middle two fingers. So this is Sujok body. And now where is left hand? In Sujok body, where is left hand? This is left hand, correct?
This is left hand.
Correct?
Yes.
Left upper arm, left lower arm, and left hand. Okay. Now I have reached left hand. And in left hand, where are two fingers? Where are middle two fingers? So somewhere here you will find. Somewhere here you will find if I remove this tape. So so it means you have to massage this area to treat this part. Did you get my point?
Yes. Thank you so much. Once again, thank you.
Madam, good evening.
Good evening, Ji.
I have lumbar spondylosis for last 8 years. Many doctors, they are sitting with their knives to set me right. But I have not done that. I have not given up. I'm not having much pain in the back, but I am having numbness in my feet.
Because
Left
of
side,
this.
left side, I'm having numbness from calf downwards. Right side, ankle downwards, right till the sole.
Yes. So, yes, you pay attention to all lumbar points like we have discussed today. Lumbar points on finger, lumbar points on this main system. You start doing this because it is related to lumbar area, this area only. Yes. So start doing it. Do ring massage and all points on this one day left hand, second day right hand. Give good attention to these points and you will see the change.
The numbness is not going. This I'm doing for a few days. Numbness is not going.
It will take time. It has many reasons. And also on index finger, middle line, put orange line. Start putting orange line. Center line. Yes, orange line.
Okay. Thank you.
And if you can do moksha, if you can manage moksha, then moksha is very good on lumbar area and the place where you have numbness.
Moksha, I've not understood. What is moksha?
Okay, maybe next time I will introduce because in previous and old sessions I have discussed how to use this, but now we have started from the beginning, so this session will also come.
Okay.
I will teach properly and then you can use. Yes.
Thank you. Thank you so much.
Thank you.
Ma'am, few more doubts people have. What should I do?
I am ready.
Okay, ma'am.
I can hear.
Good evening, madam. Good evening.
Good evening.
I'm Smita Baheti. Actually, I had a Bell's palsy 4 years back. Left side Bell's palsy.
This case is like I have to explain in detail. So in one in this time I cannot touch this big subject.
Okay. Okay,
Yeah.
ma'am.
If small, yes. If something which is I can explain in this time, I will explain. But this
Actually, I have a slight effect on eyes. My eyes are not totally open. Means sometimes it is smaller, sometimes it is open fully, but sometimes it is smaller.
Okay, I will tell you eye point and next series I will explore more. So you know that this is right eye and this is left eye as per basic system. In sex system also we have right eye, left eye. So after doing good massage, start putting black pepper seed on these eye points.
Okay.
See?
Yes.
Okay.
Only on thumb or all fingers? Only on thumb, no?
Only one thumb and you can use one index finger.
Index finger, okay. For how many hours?
6 hours at least.
Oh, 6 hours. Yeah. Thank you.
Yes, Meenuji.
मैम सॉरी मैम आई डिस्टर्ब यू मैम
No, no.
मेरा लेफ्ट पैर में लिटिल फिंगर के एंकल जॉइंट पे बहुत पेन रहता है हमेशा
लेफ्ट पैर
हाँ लेफ्ट नीचे एकदम एंकल जॉइंट जस्ट दिस एंकल जॉइंट हाँ हाँ दिस साइड
Okay.
लेफ्ट साइड
So today you will do it if you have ring. In left hand, middle finger, this joint.
Okay.
This joint. Yes. Ring massage nicely and methi seed. You can roll it. Cover this complete joint with methi seed, fenugreek seed.
Okay.
And keep it for 6 to 8 hours and do it for 1 week and see the change.
Okay, ma'am. Thank you, ma'am.
And then you can add more also if you're feeling relief and some percentage is left, then you can do more also.
Okay, ma'am. Thank you, ma'am.
Unmute yourself, sir. Yeah. Sir, we are unable to hear you somehow.
Namaste, ma'am.
Yeah, please continue, ma'am.
Yes, please. Yes, you can ask.
Okay. So, yeah, I have chondromalacia patella on both my knees. So, can you please guide me?
Yes, yes. Like as of now, you can start doing knee point, but then later we need to add our 6 key knowledge also. But here, middle finger, middle joint, massage every day, and seats.
This part.
This part, middle finger, both hand, middle finger, middle joint.
Sure.
Yes, massage
Yeah.
nicely.
Yeah.
And then seeds. Keep it for 6 to 8 hours. Every day do.
Okay. Thank you.
Yes.
Kumaran sir, we are unable to hear you. Can you please post your question in the group, or you can even ask next time also, next Monday, if possible. We are unable to hear you, sir.
Hello, ma'am. Can you hear me?
Yes, yes, I can hear you.
Unmute yourself, ma'am. Neeta, ma'am.
Yes, unmute. I have pain in a right hand, 3 fingers, and numbness also.
Do you have diabetes?
No, ma'am. And return also pain and chopping, return sometimes.
Okay. Any other disease? Any medical
No,
history?
nothing. Nothing.
Okay. So you have problem in right hand.
Yes.
Then in right hand.
Also, ma'am, my thumb structure is little change. Thumb structure. I can कुछ लेती हूँ हाथ से, then it's not proper. Little seeds, methi seeds, and black pepper. I'm not picked proper.
Okay. So right hand, and this is actually your right arm, and this is this last part is your right
Palm
hand in Sujok.
Right hand here. Yes. Sujok.
Sujok. So this part, so first you have to keep this area in your mind. In right hand, this area is corresponding to your right hand. So you massage this area nicely. More often ring massage on this area, and then cover this area, especially around nail tip area. Cover this area with fenugreek seed.
Okay.
Press from time to time, and also if possible do moxa. And just remember this area, I want you to focus this area and back side, just
Okay.
below the nail. Yes.
Okay. Okay. Thank you so much, ma'am. Thank you.
Ma'am, Kumaran sir has pain on his 1 second, I'll just read the message. Sole of the feet. Both feet.
Both feet. Okay.
Yeah, from past 1 year.
Okay. Okay. So both hand, middle finger. First of all, you have to take both hand, middle finger, and the top phalange, this one, or we can say the lower phalange. So this area, see this area, and in this hand, this area. Massage, pain, you have pain, then first massage. If you have ring, then it is very good. If you don't have ring, then massage very nicely until this finger, this tip become warm. This area. Yes. After that, again, you can 1 day fenugreek seed, tie this, fill this area with seed, and second day black pepper seed. This complete area you should cover with black pepper seed, small black pepper, small size black pepper seed, and 1 day with fenugreek seed. If you can manage moxa. So ring, moxa, if you have it, it is very good. But in case you don't have it, at least start treatment. Do manual massage, warm up this area nicely until you feel this tip becomes warm. Cover this area with fenugreek seed, 1 day fenugreek and second day black pepper, and then keep this these seeds for 6 hours or 6 to 8 hours, and the next day you do it again. Continuously do it for 1 week, and then see the change. And in case body needs more, you can add more sessions. Understood? Okay, good.
Smile, thank you for this session, ma'am. We are so much grateful to you.
Thank you.
And gratitude for everyone for joining this session. And again, we remind you, please join the sessions very regularly. Go through the recordings. It's always being provided in all the groups. All the recordings are provided in all the groups. So please go through before the session so that you are fully thorough with the past sessions. Then you can absorb the present session's information. Okay. So a kind request to all of you to please join the sessions without fail, because live sessions are very much imaginary. Is like watching videos is not, recordings is not so important, but watching it live is so important so that you can grasp more and more knowledge. So once again, thank you so much, ma'am. Smile, thank you to you. Divine blessings be with you, ma'am.
Thank you.
From all of us. Gratitude, ma'am. See you
Next Monday. Thank you.
Monday. Yeah. Thank you, ma'am. Good night, ma'am.
Good night. Bye-bye. Thank you.
Bye, ma'am.
Bye-bye.
Thank you.
Smile, thank you.
Thank you so
ma'am.
much, ma'am.
Thank you so much.
Thank you, ma'am.